September 1928. Inside a quiet laboratory at St. Mary's Hospital in London, dozens of glass Petri dishes were scattered across a workbench. Each one contained colonies of dangerous bacteria, carefully grown for experiments. To anyone walking past, it looked like just another ordinary day in a scientist's lab. But hidden inside one forgotten dish was a discovery that would save hundreds of millions of lives. Ironically, it wasn't made by a genius following a perfect plan. It happened because someone forgot to clean up. The scientist was Alexander Fleming, a Scottish bacteriologist who had spent years studying bacteria and searching for better ways to fight infections. Back then, even a tiny cut could become a death sentence. Today, a scraped knee might need nothing more than a bandage. But in the early 1900s, there were no antibiotics. If harmful bacteria entered the body, doctors had very few ways to stop them. People died from infected wounds. Simple surgeries often became fatal. Childbirth carried enormous risks. Pneumonia, scarlet fever, blood poisoning, and countless other infections killed millions every year. Doctors could clean wounds with antiseptics, but these chemicals often damaged healthy tissue as well. The medical world desperately needed something that could kill bacteria without harming the patient. Fleming understood this problem better than anyone. During World War I, he served as an army doctor and witnessed soldiers arriving with injuries that should have been survivable. Instead, many died days later, not from bullets or explosions, but from bacterial infections spreading through their bodies. Watching countless patients die left a lasting impression. He became determined to find a better solution. For years, Fleming experimented with different bacteria in his laboratory. His colleagues admired his sharp observational skills, but his workspace had a reputation of its own. Unlike many scientists who kept everything perfectly organized, Fleming's laboratory was famously untidy. Petri dishes sat stacked on benches. Cultures remained for days before being cleaned away. To some people, it looked like complete chaos. But sometimes, discoveries hide inside chaos. In late August 1928, Fleming left London for a short holiday with his family. Before leaving, he placed several dishes containing Staphylococcus bacteria on a laboratory bench. Normally, they would have been cleaned immediately. Instead, they stayed there for nearly 2 weeks. While Fleming enjoyed his holiday, something invisible was happening inside the laboratory. One tiny mold spore floated through an open window. Nobody noticed it. The spore landed inside one forgotten Petri dish. If it had landed almost anywhere else, history might have been completely different. Over the following days, the mold slowly began to grow. At the same time, millions of bacteria continued multiplying around it. Then something extraordinary happened. The bacteria closest to the mold began disappearing, not slowing down and not changing color. They simply died. Around the mold appeared a perfectly clear circle where no bacteria could survive. It looked as though the mold had created an invisible force field. Weeks later, Fleming returned to work. As usual, he began sorting through the old dishes before throwing them away. Most looked exactly as expected, but one plate made him stop. He stared at it. Inside the dish was an unusual greenish-blue mold. Surrounding it was a perfectly clear ring. Outside the ring, bacteria grew normally. Inside it, nothing. Many scientists might have thrown the contaminated plate into the bin without a second thought. After all, contamination usually meant the experiment had failed. But Fleming wasn't like most scientists. Instead of seeing a ruined experiment, he saw a question. Why were the bacteria disappearing? He picked up the dish and examined it carefully. The closer bacteria were to the mold, the fewer remained alive. The pattern was impossible to ignore. Whatever this mold was producing, it seemed capable of killing bacteria while leaving everything else untouched. Fleming realized he might be looking at something medicine had never seen before. But one mysterious Petri dish wasn't enough. He needed proof. Was this simply a strange coincidence, or had nature accidentally revealed one of its greatest secrets? The answer would begin a journey that would completely transform modern medicine. Fleming refused to dismiss what he had seen as a laboratory accident. Instead, he carefully cut a small sample of the mysterious mold and began growing it in fresh containers. His goal was simple: find out whether the mold itself was killing the bacteria, or if something else had caused the strange clear circle. As the mold grew, it released a liquid into its surroundings. Fleming collected this liquid and mixed it with different kinds of bacteria. The results were astonishing. Many dangerous bacteria that cause diseases such as pneumonia, scarlet fever, and blood poisoning simply stopped growing. Some were destroyed completely, but not every bacterium was affected. Certain species continued growing as if nothing had happened. This told Fleming something important. The substance wasn't a general poison. It seemed to target specific bacteria while leaving others alone. That was exactly what doctors had been searching for. Most antiseptics of the time worked like fire. They killed bacteria, but they also damaged healthy human tissue. This mysterious substance behaved differently. It attacked harmful microbes without being dangerously toxic to the body. The mold itself belonged to a group called Penicillium, so Fleming named the substance it produced as penicillin. It was a simple name, but it would soon become one of the most famous words in medical history. Fleming published his findings in 1929, describing how penicillin could kill certain bacteria in laboratory experiments. He believed it had enormous medical potential, yet the scientific world hardly noticed. The paper received little attention. Many researchers thought the discovery was interesting, but impractical. The biggest problem wasn't proving penicillin worked, it was producing enough of it. The mold created only tiny amounts of the substance, and it broke down quickly once extracted. Fleming tried different methods to purify it, but every attempt failed. The more he worked, the more frustrating the challenge became. Without a way to produce large quantities, penicillin couldn't become a medicine. Years passed. The Petri dish that had amazed Fleming slowly became little more than a scientific curiosity. Many people forgot about it entirely. It seemed as though one of history's greatest discoveries might never leave the laboratory. But science often moves in unexpected ways. Nearly a decade later, hundreds of kilometers away at the University of Oxford, another group of scientists came across Fleming's forgotten research paper. Unlike many before them, they didn't see a failed experiment, and they saw an unfinished mission. Led by Australian pathologist Howard Florey, German-born biochemist Ernst Chain, and a talented team of researchers, they believed Fleming had been right all along. If they could solve the production problem, penicillin might become the world's first true antibiotic. The challenge ahead was enormous. The mold grew slowly. It produced only microscopic amounts of penicillin. Thousands of liters of culture would be needed just to treat a handful of patients. Still, the team refused to give up. Using every container they could find, including bottles, trays, milk churns, and even bedpans, they began growing the mold on a much larger scale. Day after day, they collected tiny amounts of penicillin, purified it, and tested it. Progress was painfully slow, but with each experiment, they moved one step closer to turning a forgotten laboratory accident into a life-saving medicine. None of them realized that the world was about to enter its darkest conflict, and millions of lives would soon depend on what they were creating. In 1939, the world changed. World War II had begun. Across Europe, millions of soldiers were once again facing gunshot wounds, burns, and deep injuries. But just as in the First World War, many wouldn't die from the wounds themselves. They would die from infection. For Howard Florey, Ernst Chain, and their team at Oxford, the timing couldn't have been more urgent. If penicillin truly worked, it could save countless lives. But first, they had to prove it. The researchers began by testing penicillin on laboratory mice. They infected 8 mice with deadly bacteria. 4 of them received penicillin. The other 4 received no treatment. By the next morning, the untreated mice had all died. The 4 treated with penicillin were still alive. It was the first clear proof that penicillin could fight deadly bacterial infections inside a living body. The results were so remarkable that the team immediately prepared for human trials. In early 1941, a 43-year-old policeman named Albert Alexander became the first seriously ill patient to receive penicillin. A small scratch from a rose bush had become infected. The infection spread rapidly across his face, eyes, lungs, and bloodstream. Despite every available treatment, doctors believed he would soon die. With no other options left, they injected him with penicillin. The results seemed almost miraculous. Within just a day, his fever dropped. His swelling began to disappear, and his appetite returned. For the first time in weeks, he showed real signs of recovery. The hospital staff were amazed. But there was one devastating problem. There wasn't enough penicillin. The Oxford laboratory could only produce tiny amounts. The doctors even collected Albert's urine because much of the drug left the body unchanged. They purified the penicillin from his urine and injected it back into him, trying to stretch every precious drop. Even that wasn't enough. After 5 days, the supply ran out. Without penicillin, the infection returned. A few weeks later, Albert Alexander died. His death was heartbreaking, but it proved something extraordinary. Penicillin worked. The only thing standing between life and death was producing enough of it. The British government recognized its importance, but wartime Britain lacked the factories needed for large-scale production, so the search moved across the Atlantic. In the United States, scientists, universities, and pharmaceutical companies joined forces. They searched for better strains of penicillium that produced more penicillin. One day, researchers discovered an unusually productive mold growing on a moldy cantaloupe melon in a market. That single mold strain dramatically increased production. Engineers also developed a new technique called deep tank fermentation, allowing the mold to grow in huge tanks filled with nutrient-rich liquid. Instead of producing milligrams, factories could now produce kilograms. Production increased at an astonishing pace. By 1944, enough penicillin was available to supply Allied troops preparing for the D-Day invasion of Normandy. For thousands of wounded soldiers, what had once been a fatal infection became a treatable condition. A discovery that began in one forgotten Petri dish had become one of the most powerful weapons of the war. As World War II continued, penicillin production expanded at an incredible speed. Factories that had once manufactured ordinary chemicals were transformed into facilities producing one of the world's most valuable medicines. By the end of the war, millions of doses had been distributed to hospitals and military units around the world. For the first time in history, doctors could reliably treat infections that had once been almost impossible to stop. Diseases such as pneumonia, scarlet fever, syphilis, and blood poisoning, which had claimed millions of lives for centuries, were suddenly becoming treatable. Survival rates after surgery improved dramatically. Childbirth became much safer. Even minor cuts and injuries no longer carried the constant fear of a deadly infection. Medicine had entered a completely new era. In 1945, Alexander Fleming, Howard Florey, and Ernst Chain were jointly awarded the Nobel Prize in Physiology or Medicine for their contributions to the discovery and development of penicillin. It was a recognition not just of a single discovery, but of a breakthrough that had transformed healthcare forever. Yet Fleming used the occasion to deliver an important warning. He explained that if people used penicillin incorrectly, bacteria could gradually evolve and become resistant to it. At the time, many thought this was only a theoretical concern. But Fleming understood something fundamental about nature. Bacteria reproduce incredibly fast. Within a large population, a few may naturally survive an antibiotic treatment because of random genetic changes. If a patient stops taking antibiotics too early, those surviving bacteria can multiply. Over time, entire populations become resistant to medicines that once killed them with ease. Today, that warning has become one of medicine's greatest challenges. Around the world, antibiotic-resistant bacteria are making some infections increasingly difficult to treat. Scientists continue searching for new antibiotics, while encouraging the responsible use of existing ones. It is a reminder that even the greatest medical discoveries must be used wisely. Looking back, the story of penicillin is almost unbelievable. A forgotten Petri dish, a drifting mold spore, and an untidy laboratory. A scientist curious enough to ask one simple question. Had Alexander Fleming cleaned his laboratory before leaving for holiday? Had the mold landed on a different dish? Had he ignored the contamination and thrown the plate away? Modern medicine might have developed very differently. History often celebrates carefully planned inventions, but penicillin reminds us that some of humanity's greatest discoveries begin with pure chance. Chance alone, however, wasn't enough. It took Fleming's curiosity to notice the unusual mold. It took Florey, Chain, and their team to transform that observation into a real medicine. And it took thousands of scientists, engineers, factory workers, and doctors to bring penicillin to the people who needed it most. Today, more than 90 years after that accidental discovery in a London laboratory, antibiotics have saved hundreds of millions of lives. They have made complex surgeries possible. They have allowed organ transplants to succeed. They have protected premature babies, cancer patients, and countless others whose immune systems are vulnerable to infection. Every time a bacterial infection is successfully treated with antibiotics, the legacy of that forgotten Petri dish lives on. One tiny accident, one curious scientist, and one discovery that changed the course of human history forever.